You have amazing skin.
My number one anti-aging cream has always been sunscreen. And I can say that I practice what I preach with that.
Hello guys, this is Anita Lwanga. I'm here with my friend Dr. Brenda Dintiman. She is a dermatologist. She also specializes in cosmetic dermatology. I'm so happy to have you here as my guest. Thank you for agreeing to chat with me. And we were just talking about this is the first recording I'm doing. So I'm very excited to have you, and we're kind of bootlegging it, but we're still going to make it happen. So Dr. Dintiman, could you tell us a little bit about yourself?
Sure. I am a board certified dermatologist for over 30 years. And I kind of came into dermatology in a very serendipitous way. I was an internal medicine intern at the University of Hawaii because my husband was military. And one of our rotations, I basically got assigned to dermatology. I had no interest at all, except my attending was a quite interesting man who had over 80 Hansen's disease or leprosy patients. So his practice was so interesting that he asked me, why don't you consider dermatology? So I worked in Hawaii first in the emergency room. I was pretty sure I wanted to be an emergency room doctor. And then on Saturdays, I would work for him. Little by little, I kind of fell in love with dermatology.
Wow, that is such an interesting way to come to dermatology, internal medicine and then ER and then dermatology. And I think that probably makes you a very well-rounded physician because you have interests in other parts of medicine besides dermatology, but you came to dermatology in a way that exposed you to many different types of medicine. That's a very interesting story and a very unique story. So who would you say is one of your biggest role models?
Well, this Dr. Doug Johnson is one of my biggest role models, and his colleague, David Elpern. Both of them were the ones that I worked under in Hawaii, one in Kauai. I would fly to Kauai twice a week to see patients. And the thing that's amazing about Dr. Doug Johnson is he's in his 70s. And throughout his whole career, he's always given back to the free clinics. And now he even flies to Samoa and Micronesia to take care of patients. So he has really instilled in me the two things. One, the desire to keep helping those that can't help themselves well, and not to be afraid to think of myself like an internal medicine physician first with the subspecialty of dermatology. So it helps you to be a little bit more courageous in the way sometimes you're trained, if you've been trained to always be referring to others. So he's one of my mentors.
Wow, he sounds like an amazing person. Is he still semi-practicing dermatology or no longer practicing dermatology?
Definitely still practicing. He speaks all over the world. So he's a hard person to keep up with.
I think that generation of physicians have a very different work ethic and such a passion for medicine. I think it's really commendable to still love what you're doing and just do it because it's a calling, it's a passion. That's very cool. I'm gonna have to look him up.
Definitely.
You have amazing skin. And I feel like all the dermatologists have these secrets. I'm like, I tease my friends. I'm like, my glamazon sisters, my dermatology sisters always have these secrets that the rest of us don't know. And we're always curious to learn. So I would love to hear a little bit about your skincare routine.
Well, my number one secret is pick your parents.
Oh,
my mother was Puerto Rican and she had beautiful skin. But now I realize I have to give credit to my German father, who has never worn a lick of sunscreen and has very nice skin. So some of it's things you can't change. But my number one anti-aging cream has always been sunscreen. And I can say that I practice what I preach with that. I don't burn easily, but yet I always wear sunscreen. And now the sunscreens have gotten so much better that they're more like a light makeup or cover up. They have a tint so they don't look so ashy. The worst thing was when I was younger, you would put on a sunscreen and you would look white or ashy, and you really looked like you unattractive trying to wear your sunscreen. And they didn't blend with any makeup or any other things, moisturizers. So that's the number one thing that we tend to do, and use a retinol at night. Retinol is tried and true. I just was researching it again because it can be overwhelming how many products there are out there, even for me.
Okay, that is great. I love that. I love that. Sunscreen and retinol for everyone. And I think we're going to have to talk more about this sunscreen topic. I've had a lot of people, especially people of color, make comments about like, no, you don't need sunscreen. We're fine. But I have a lot of different thoughts about that. I agree with the sunscreen thing, but I think we're going to have a full conversation about that and convince people who don't typically wear sunscreen, please wear your sunscreen.
Well, even though you might not get a sunburn,
Mhm.
you may get unevenness of the color of your skin. You still can get rough spots and signs of aging, and you're definitely going to get more wrinkles. So, and we forget that skin of color can definitely get melanoma, because you don't always get melanoma where the sun shines, and also you can get skin cancers even though you think you're not burning. So it's very
Okay.
important medically also.
Absolutely. Absolutely. I have a few more questions. I think one of the questions I have is, what are some of the most common skin diseases you treat? And how have advances in technology and various treatments impacted your approach?
Well, the most common things we treat are we do skin exams trying to detect skin cancers. The most common skin cancers are basal cell carcinoma, and those are mainly where you burned as a child and where you're continuing to burn, squamous cell carcinoma, and the most concerning one, the melanomas, which can be anywhere on your body, including the bottom of your feet, in
Mm.
the eye, on the scalp. But we treat a lot of that. We see a lot of rosacea and acne, and I feel like we're seeing more of it in people that are perimenopausal, menopausal, and even very young people. I think now that we're seeing more PCOS, I feel like we're dealing with different types of acne, different types of rosacea than I saw earlier in my career. The advancements with that have been more, well, one thing that's fascinating is that we always treated rosacea with metronidazole, a very common topical antibiotic. And in the last, I'd say 8 to 10 years, we now use topical ivermectin cream,
Mm.
because many patients will have Demodex mites that have overgrown in the skin and create pustules, whiteheads, and sort of a rough texture. I saw a lot of this during COVID too, and I think the mask contributed, almost creating a little sauna where there was inflammation created from the sweating and more oiliness of the skin.
Oh, that is another topic that I would also like to talk to you about. There's maskne, but it sounds like there's also other skin conditions that came with the whole pandemic. So that is, to me, a very interesting topic, and I think a lot of us struggled and did silly things to ourselves during the pandemic.
Yes.
And another thing that you touched on is how our skin changes during menopause and the perimenopausal phases of our lives. So, what are some of the changes people often come to you and complain about when they reach the perimenopausal and menopausal years of their life?
Well, we'll often see that people will develop itching. They can develop itching on the back, on the neck, in places where they never had eczema before as a child. And we think that that can be some of the estrogen, progesterone changes in their body. We definitely see a recurrence of acne. And I think, again, just like we're learning more about menopause, that there can be spikes of estrogen, then lower estrogen. And also, I'll find that as their estrogen gets lower, their androgens are more dominant. So they're getting some excess hair, hirsutism, hair loss, and
Mm.
a flare of acne that they didn't have in their teens.
Wow, that is so fascinating. So, would you say that once people start to see these changes, is this the time that people would initially come to see a dermatologist? Or do you feel like people, if they already have the awareness of what a dermatologist is and what they do, they come because they just notice these changes in their skin?
Yeah, I think they come to get help with their skin. They don't like the inflammation they're seeing and they can't cover it with makeup. Some of the cysts are painful, and we can use a combination of oral medications like spironolactone.
Hmm.
When I first started, all we did was antibiotics, antibiotics, antibiotics. But now we know with the disruption of the gastric microbiome that we try to use antibiotics very sparingly,
Hmm.
and then we put them on something, spironolactone, that blocks the androgen receptors and really helps them with those deep hormonal cysts. They may not have the typical blackheads that we call comedones that you have in teenage years, but they tend to get a lot of breakout around the mouth and deeper ones that can be quite disturbing and uncomfortable.
Wow, that is so fascinating that you talk about spironolactone, because as an internist, we use spironolactone more for like high blood pressure sometimes, but more things like heart failure to help people get rid of excess fluid. So it's so interesting how, as time has gone by, some of the medications that were used for one purpose are used for another purpose as well. Because we were taught, probably all in med school, that spironolactone has some, I think, is it androgen blocking properties. So that's very interesting how that has been also used in dermatology to help manage those cosmetic conditions. I think medicine is so fascinating, and as we come up with new discoveries, how we use medications is very interesting. Another question for you. Is there anything else or any other changes besides some of the more maybe superficial changes that people would notice as they get wiser, besides, say, the hyperpigmentation, the acne?
Well, definitely you see a huge difference in who has been protecting themselves from the sun and who hasn't.
Oh,
We see, lots of fine lines and loss of the consistency and the elasticity of their skin. Definitely, that's what we call wrinkles. Some people will get very superficial lines, and other people will get the loss of volume. You will lose volume in your mid face and loss of volume here that leads to the jowling. So that's part of why fillers have become so popular. And I'm of the mentality that I like people to love the skin they're in, but to look natural. So I like them to look at themselves how they were 10 years ago. They probably had fuller cheeks then. So we add some volume here. We're trying to lift areas to counter jowls. But I'm not a proponent of changing what somebody looks like. Their beauty, I feel like they have the essence of their beauty, but that's a different philosophy that we see definitely in Instagram and social media, that a lot of young people are really trying to have lips that they weren't born with, technique, cheekbones they weren't born with, and really dramatically change the way they look. So it's an interesting topic for sure.
That's very interesting. Thank you for sharing your perspective. I like your perspective in terms of trying to make people look like what they look like when they're younger, rather than completely changing how they look. And with that in mind, when would you think that somebody would consider or might consider Botox and fillers? What you think is a reasonable age, rather than, say, being 18?
Yeah, I think we do pre-tox on people, and we call it pre-tox. Say you're someone who always raises your eyes and makes deep lines. You could have had that from the time you were 16. And those lines are like a piece of paper that you keep crinkling, and try to lay the paper down, and it still has a line or a crease in it. So by softening that muscle use, and especially I see it in runners, I see it in long distance runners, there'll be like an intensity of that they're frowners. And sometimes genetically and with their sports, their frown will be kind of overly dramatic for their age. So they might be getting toxins, neurotoxins in their 20s, in their 30s. But we always ask them to wear sunscreen first before they want to do anything else. If they ask for laser, if they ask for peels, we have to get them on a tinted sunscreen regimen first.
Very interesting. And for people of color who are trying to find a tinted sunscreen to use, do you have any brands that you might recommend that people look into?
Yeah, we usually bring out 3 or 4 of our brands that are available commercially and let people try, because even though they look good on most skin, there's usually one that looks better. Alastin has a beautiful one called Alastin Hydra Tint. La Roche-Posay has a wonderful one that's darker, on the darker, creamier side. And then Elta MD has a wonderful tinted sunscreen. So those are my 3 favorites for sure.
Okay.
And then Tizo also. There's one called Tizo. And the thing that's nice about them is they feel very elegant and silky. You don't feel like you're wearing a heavy mask of sunscreen. So you can use it instead of your makeup, just daily, or then layer on makeup if you need cover up.
Okay, that's a great tip, because I think for me, that's probably one of the things I struggle with, like putting on the moisturizer, especially in winter, and then you put on the sunscreen and then reapplying. I need to ask you about reapplying because I have my own experiments I've done with reapplying, and it has not always been very successful. So what would you suggest for people who are going to try to be very diligent with reapplying their sunscreen? I think I like the tinted one, so you don't have to keep layering lotion on top of the sunscreen on top of makeup, but reapplying, what would you suggest people do?
I think I keep forgetting to tell you that I prefer them to be mineral-based sunscreen. So the ones that are titanium and zinc will stay put a little bit better. They won't sweat off as easily. And then those are the ones that you need the tint in it to soften it and even out the coloring. And they don't burn your eyes. So you're more apt to not even be afraid to pat them so close and on your eyelids. And that area is the most vulnerable. So it's a great way to prevent damage to your eyelids and those areas. Yeah.
Good to know. Good to know. Yes, I've had very interesting. I'm sure you already know the things people complain about, the eyes burning, the not
Yes.
matching, and
Yes.
trying to reapply. So thank you for sharing those tips and sharing some of your favorite products. I think the last question I'd like to ask you is not necessarily related to dermatology, but I know you're telling me about writing a chapter, and I think you can tell our audience a little bit more about that, a chapter in a book. But if you could write a book on a topic of your choosing, what do you think you'd write about?
Well, it's kind of a family joke because my father has written over 56 books. And all my life, I've been saying, I'd like to write a book. This should go in my book. This should be a story in my book. And my husband one time said, why don't you start with a paragraph? Because it's a lot harder to write a book than you realize. But in recent years, and now with the motivation of Dr. Una to write a chapter, my book would be vignettes of patient stories and what I've learned from my patients. Because all along, I've been collecting stories and things that I've learned from my patients along the way. Sometimes I feel like I've learned more from them than they learned from me.
Oh, wow. 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 That's
So
amazing.
hopefully I'll do it.
Yeah, I'm going to ask you in a couple of years, what's your timeline?
I better do it soon, right?
Yes, I'll come and ask you.
I wrote 3 paragraphs. I better keep going.
Yes, okay. So maybe this time next year I'll check on you. I'll be like, hey, how's your book going? And then we can share it with our audience because I'm sure they'd love to hear that.
Yes.
Yes, but that's very interesting. And thank you so much for taking the time to talk with me and to share your knowledge with our audience. For those individuals who are looking for dermatologists, where can people find you online and in real life?
Well, my practice is in Vienna, Virginia, Northern Virginia, outside of DC. And we have a website, Derm Utopia, as well as an online app that you can access. And we have accessibility in some states, not all states. But otherwise, if you need a dermatologist, you go to the American Academy of Dermatology and you'll get a list of board certified dermatologists.
Great. Thank you so much for having us. I will make sure that we put a link to your website below the show and a link to your other social media sites so that people can follow you and can learn more about you. Thanks again, guys, for watching this show. If you have any people that you'd like me to host on the show or any questions for any medical specialists and or health specialists, please share them with us and we will catch up with you in the next show. Bye-bye for now.